to teach, to heal, together. Western University of Health Sciences. Welcome to A Tribute to Caring. Frontliners, WesternU Heroes respond. Please welcome tonight's host, the Senior Vice President for University Advancement at WesternU, Dr. Diane Abraham.
Hello everyone, I'm Dr. Diane Abraham. Welcome to a very special event, WesternU's annual Student Scholarship Gala, A Tribute to Caring. Tonight's event marks a special milestone for ATC, our 40th year. It also marks a special way we are reaching out to you. Tonight we are telling the stories of WesternU students who have stepped up as heroes to assist in one of the greatest health care challenges of our time, the struggle against COVID-19. During the pandemic, these frontline heroes have offered knowledge and skills, caring and compassion. It's all part of WesternU's commitment to humanism, a cornerstone of our university's mission to prepare healthcare professionals in a humanistic tradition. We are grateful for our frontliners' efforts, but also for the crucial support of donors like you who contribute each year so the WesternU mission continues. The stories are inspiring. They reveal creative and compassionate ways in which members of the WesternU community have battled against COVID-19. Hear how Arjun Bakshi, a third-year medical student, helped address a serious equipment shortage that emerged early in the pandemic.
Yes, Dr. Abram. When the pandemic was ramping up, I saw the need for personal protective equipment and wanted to take action. I've worked as an EMT and emergency room trauma technician, so I couldn't imagine what it would be like to work without PPE. I recruited over 100 members to a Facebook group where we coordinated drop-off and pickup of donated masks. We handmade close to 2,000 face masks, purchased 895 masks from a private vendor, and raised $3,000 through GoFundMe to donate to 6 hospitals. When we saw hospital staff wearing our masks, we knew our long nights had been well spent.
Arjun was one of the many students whose pandemic efforts were coordinated by WesternU faculty members. Without support from faculty and staff, and from people like you who contribute to the university's larger mission, Arjun's masks may never have been delivered, nor other equipment that specifically targeted homeless shelters provided by fourth-year student Farham Hamati.
That's right, Dr. Abraham. WesternU was extremely important in helping me to set up the nonprofit Hamati Foundation. My brothers and I assembled a team of medical students to distribute PPE to homeless shelters at a time when they were being forgotten. Our first donation was to the Raphael House in San Francisco. We had mixed emotions about whether the mask would be needed, but the look of happiness on the manager's face showed we were making a difference. Since then, we have donated thousands of masks, gloves, and dry foods to over 55 shelters across the United States. And our work was even recently featured on the Good Morning America.
Farhan credits WesternU Associate Professor of Internal Medicine, Dr. Edward Barnes, for helping to promote his idea.
That's right, Dr. Abraham. In the beginning of the pandemic, students were largely excluded from the care of patients due to lack of available PPE. All of our student rotations, free clinics, and volunteer opportunities were being canceled. But our students wanted to stay involved. A new student group emerged on campus called Project Social Connect, with the goal of providing virtual opportunities that support patients and healthcare workers. Students in this group have helped to curb some of the effects of social isolation for patients and have offered words of support for healthcare providers in nursing homes.
Another student inspired by Dr. Barnes was Azaria Lewis, who immersed herself in a healthcare concern that arose early on when COVID-19 began to reveal racial disparities in healthcare delivery. As a graduate of WesternU's biomedical sciences program, and now full-time student in osteopathic medicine, Azaria seeks to address such disparities through a new campus-wide effort.
Dr. Abraham, my journey of becoming president of the Pomona chapter of White Coats for Black Lives has been the highlight of my student experience. After building an executive board, WesternU Students for Racial Justice helped me to select and involve students from each of the 9 colleges to draft a petition calling for anti-racism changing at the university. Our ideas led to a new campus chief diversity officer and 2 directors of anti-racism curriculum within our college. By including anti-racism curriculum in the medical curriculum, WesternU can help to mitigate racial health care disparities due to implicit bias.
During the pandemic, Azaria also helped launch another project targeting food-related disparities in the Pomona community.
Yes, Dr. Abraham. Research shows that food deserts, where people have limited access to affordable and nutritious food, are largely found in minority neighborhoods, such as Pomona, California. So we recently launched the WesternU Food Pharmacy, which will play a role in improving the health of our underserved community members and promote plant-based eating, even during a pandemic. If every hospital or clinic had an on-site plant-based food pharmacy that offered food pharmacy services to every food insecure patient, we would also see a huge decline in nationwide healthcare costs.
Efforts like these demonstrate a second major emphasis of WesternU's mission to enhance and extend the quality of life in our communities. During the pandemic, 2 students in the Master of Science and Nursing program, Erica DeHaro and Gladys Viallo, made sure an important community health education service would not be overlooked due to COVID's face-to-face restrictions.
That's right, Dr. Abraham. COVID has already taken away so much from the community. We didn't want to take away our community health and wellness workshops. These workshops are traditionally for families and they are held out in the community. When we could no longer do that, we decided to reinvent them. A group of us put together Connect Pomona to offer virtual classes with fun interaction, all while having important health learning topics.
A mother of a 2nd grader has told us how much she appreciates the workshops. Her daughter, who is home all day, has learned the importance of how to stay safe during the COVID-19 pandemic, has learned how to create healthy, balanced, nutritious foods, all while having hands-on fun interacting with others.
WesternU has always taught us humanism, and that is what Connect Pomona is doing.
We especially need to remember this during the pandemic so we can support one another.
Meanwhile, students like Joseph Kim from the College of Podiatric Medicine took a more hands-on approach in following the call to humanism, seeking out members of each community where he was placed during his clinical externships.
Dr. Abraham, I believe humanism means connecting with others through our own pain and suffering. Though my own family has been struggling financially during the pandemic, I know there are people struggling even more. For many months, I've been helping homeless people near my externship sites in place, such as Tucson, San Francisco, and Farmington Hills, Michigan. I prepare bags of food, snacks, and water and search for the homeless people to give them to. I see their joyful faces when they receive something to eat and drink for a day. It makes me feel blessed despite my financial hardship. I'm grateful I have a house to live in and food to eat.
Of course, community outreach is nothing new for students at WesternU's close-knit Oregon campus, who have a long-standing practice of working with members of communities throughout Southern Oregon. Dr. Maribel Fernandez-Paul explains.
Thank you, Dr. Abraham. Medical students at Comp Northwest have made a difference in their local communities since the COVID-19 pandemic began. When several residents at the local veterans home became ill with the coronavirus in March of 2020, our military students fundraised for over $3,000. These funds were used to support the VA staff who were working around the clock to care for our nation's bravest. Several Comp Northwest students volunteer for crisis lines used by people all over the country who may be feeling stressed or suicidal. This is especially pertinent during the pandemic. Many students have taken the Johns Hopkins Contact Tracer course and support their communities as needed. Our 3rd and 4th year students are serving on clinical teams that are caring for COVID-19 patients of various ages. Several students have even participated in the phase 3 clinical trials of the COVID-19 vaccine and are now helping administer vaccines.
Understandably, the nature of the healthcare professions has placed many WesternU students in contact with those suffering from the virus. One was pharmacy student Leslie Bonuelos.
That's correct, Dr. Abraham. When the pandemic started last March, I was working at CVS Pharmacy and doing rotations at Walgreens. Working in a community pharmacy during this time was eye-opening. Frightened people were stocking up on items and coming to the pharmacy to ask questions. While I value educating members of the community, I wanted to get more involved with those directly affected by COVID-19. That opportunity came. As an intern pharmacist at UC Irvine Medical Center, I began assisting patients in dire needs of services. From the clinical pharmacist, I also learned a lot about clinical trials going on at UCI with experimental treatments like remdesivir. I'm overjoyed to be working in an inpatient setting with people most affected by COVID-19.
Over the course of the pandemic, students have assisted with COVID-19 testing on the WesternU campus and elsewhere. And many are now providing vaccinations at clinics located at various sites. All volunteer efforts spearheaded by WesternU faculty members. Clearly, as the fight against COVID has intensified, WesternU students have become more directly involved.
WesternU students have been more widely integrated into telemedicine visits, virtual conferences, and some direct care of patients. They have been involved with contact tracing and testing protocols. Some on clinical rotations are even now serving at hospitals on the front lines, aiding in the care of patients with COVID-19.
That's right, Dr. Barnes. Although I did not personally evaluate COVID-19 patients at my recent rotation site, I was still actively involved in their care since the attending physicians and residents included students in their discussion on how to proceed in treatment regimens. Cases increased daily, and there was never a day where the patients list did not include a COVID-19 patient. It was memorable to see how certain treatments worked with one individual, but not another. As a medical student, it is quite exciting to be witnessing this time in history.
Of course, humans are not the only ones in need of humanistic care during a pandemic, as we are reminded by two students from the College of Veterinary Medicine, Marcella Mancini and Ann Underwood.
Dr. Abraham, when COVID first struck, I was home for spring break in New Jersey, which was shut down for a long time. I couldn't just sit here at home while so many were working hard during a pandemic, so I began helping out at the veterinary clinic where I typically work during the summers. We had to work long hours to keep the hospital staffed due to the small number of employees allowed to work at one time. We deep cleaned the facility before and after each workday and implemented curbside service. Our clients were so grateful that we stayed open. They brought us food nearly every day, and big name companies even sent meals to help us out. Emergencies don't stop for a pandemic, so neither could we.
Like Marcella, I felt useless sitting at home and I was unable to contribute while I knew the healthcare workers were being overwhelmed. But the same thing I started to notice was happening in veterinary hospitals. So over the summer, I was able to assist at a small animal hospital. All the staff seemed to take on the role of comforter for people frustrated and afraid during the pandemic. One day I had the opportunity to help a lady who was struggling with the recent death of a pet and a new illness in her living pet. She was overwhelmed by the treatment plan and unable to communicate with the doctor due to the new COVID standards. I sat with her and calmly discussed the plan, answering her questions and providing her some relief. It was one way that I was able to help foster the human-animal bond during such uncertain times.
Yes, we are all in this together. As you are listening to these incredible stories of WesternU heroes going the extra mile, you may be wondering, how do they find time? Aren't their student burdens heavy enough? The answer reveals an interesting point about the vital role of student scholarships, as noted by third-year dental student and multiple scholarship recipient, Gregory Marchese.
During the pandemic, it became clear that we all needed to be a little better about taking care of each other's general and social needs. As part of this, I created a social media campaign under the hashtag #BeAwesomeToOneAnother. The idea behind this hashtag was to help redistribute the social goodwill that the general public had towards the heroes in healthcare and to redistribute this amongst themselves. As part of this, we engaged 50 to 60 healthcare providers, many of whom came from WesternU itself, to help spread this message. This reached critical mass at about 500,000 users on social media and was even picked up by MSNBC.com and Reader's Digest.
To a student like Gregory, a scholarship meant an opportunity to pursue a new idea he needed to explore. To Julie B. Chum, a scholarship provided the chance to revive a dream she had kept long before entering pharmacy school.
Dr. Abraham, I still remember receiving the call from my college, informing me I had been awarded the Dean's Merit Scholarship. It was just before Christmas. I felt overjoyed and blessed. With this scholarship, I knew I could do what I've always felt called to do, in serving the underserved by working for a nonprofit. Something I experienced working with a group in Nicaragua to provide free medical clinics. I have always known a nonprofit position does not pay a typical starting salary, which is a challenge due to pharmacy school debt. But when I got the call about my scholarship, I knew it was a sign. I could proceed with my dream without the financial strain I would have had otherwise.
The bottom line is that the sheer expense of attending medical school can be crushing. With 4 years of some health sciences degrees costing up to $460,000, including living expenses, most students at WesternU must carefully manage a debt load on their path to becoming healthcare professionals. Michelle Bagheri, soon to graduate from the College of Health Sciences, credits the scholarship she received for making it to the finish line.
Yes, Dr. Abraham, a financial burden is a natural byproduct of attending graduate school, but scholarships can help students redirect their resources to gain more knowledge, build clinical skills, and engage in self-development on their journey into a chosen healthcare field. My Hertz Foundation scholarship has allowed me to finally achieve my goal of graduating as a doctor of physical therapy and has eased many financial concerns along the way.
All too often, students furloughed or laid off during the pandemic have had to decide between basic necessities or their schooling. Scholarship funds may be the only saving grace allowing them to continue their pursuit of a career in the health professions.
That's right, Dr. Abraham. As a student who is married with 2 children, I have responsibilities unlike the average medical student. My scholarships have allowed me to take out fewer loans and save me money I will not have to pay back in the future. Scholarships make the cost of medical school less of a burden on me and my family's lives as well.
Just as many types of support are needed by students at WesternU, many forms of financial assistance are provided. One of our newest funding programs is the Student Emergency Support Fund, providing direct assistance to students during the pandemic, as noted by the chair of the Support Fund Committee, Christy Ho.
Thank you, Dr. Abraham. The Student Emergency Support Fund is unique because it grants funding, not a loan, to students in need. During this desperate and scary time, most students who apply for assistance are seeking support for basic human needs: housing, utilities, food, or medical costs. This funding allows students to focus on their academic goals while helping to relieve a little bit of money stress and anxiety. While it won't fix all of their problems, it will provide a safety raft to help students get through a personal emergency. All students should feel supported by their university. This safety net is one way to help.
You know, one of my greatest pleasures of working at WesternU is the chance to see the responses of students when they are named a scholarship recipient. Just as gratifying is the privilege to announce some new gift that will directly benefit our students' lives or learning. Tonight, we're pleased to announce the newly created Trustee Scholarship, further described here by the president of Western University of Health Sciences, Dr. Daniel R. Wilson.
As you know, Dr. Abraham, each year Western University of Health Sciences prepares over 1,000 well-trained, caring, and compassionate healthcare professionals To support tomorrow's graduates who will be providing the world's future frontline healthcare needs, the WesternU Board of Trustees has established a $6 million endowment, which is set to grow but already awards $300,000 per year in scholarships to students. This generous scholarship fund is a clear confirmation of how student support is a primary focus at WesternU.
News of the Trustee Scholarship is exciting, but did you know that most student support funding comes from individuals like you? Gifts from private donors like you have already neared 6 figures in scholarship funding for tonight's event. If you are wondering whether you should contribute to WesternU, maybe you should consider why others do it. What inspires them to donate? Dr. Ed Hernandez, an optometrist and former state senator, is a longtime supporter of WesternU's College of Optometry. Last year, in addition to setting up a mentoring program for Latino students in the field, he established the Optometric Professional Leadership Development Endowment, which supports minority students through mentorship and leadership development. Listen now as Dr. Hernandez reflects on his reasons for giving.
Thank you, Dr. Abraham. With this endowment, I felt it was time to give back to students with backgrounds similar to mine. As a student of modest means, I remember how difficult it was to put myself through optometry school. I also do not remember having any mentors who looked like me who came from similar backgrounds. So I started the Leadership Development Endowment to help Latino students through optometry school by providing mentoring, leadership skills, and scholarship opportunities. And I stress to these students, when they graduate, the value of returning to communities of color to provide health care.
Dr. Hernandez, how does it feel to know optometry students are benefiting from your contributions?
It is a great feeling, and recently, due to COVID and the limited time that students have in clinics, I am directly overseeing some of WesternU students in our office on their clinical rotations. We have a busy practice with a large population of Spanish-speaking patients. The students are getting valuable experience with a variety of cases and conditions. It's great to see.
Thank you again, Dr. Hernandez, for your generous gifts and for sharing your thoughts about giving. Tonight you have heard some incredible stories. You have met remarkable people committed not only to assisting on the front lines of a pandemic, but pursuing a lifetime of service. These are the men and women who one day will support us in our healthcare needs. These are the heroes. But we can all play a part. On this, the night of our 40th Scholarship Gala, we ask you to support those who will support you. In this way, you too can be a hero. If you have been touched tonight by somebody's story, if you have been inspired by their acts of caring and compassion and dreams of future healthcare careers, we ask you to make the next move. You may be asking how. How can I contribute? There are several ways. You may wish to donate to one of the scholarships for underrepresented students already in place at WesternU. Or you may wish to endow a named scholarship by establishing a new scholarship in your name or the name of a loved one. You may prefer to sponsor an academic scholarship by establishing a scholarship fund for talented students in one of our colleges or healthcare fields. Or you could help secure emergency funding for students by supporting our new Student Emergency Support Fund. In a moment, you will be provided information to guide you in placing your donation or in understanding more about how you can help. If not one of these options, then perhaps something else. If not tonight, then we hope soon. I look forward to talking with you personally and answering your questions. We applaud you for becoming part of our growing family of heroes at WesternU.
Please support those who will support you.
Thank you for spending time with us this evening, and thank you to everyone for contributing so generously to A Tribute to Caring and to the mission of Western University of Health Sciences. Good night.
To take the next step by offering a gift or contribution to WesternU, please visit alumnifriends.westernu.edu/giving/tribute. Details and links will guide you to the type of contribution you wish to make. Contact information is also provided for Dr. Abraham and WesternU's Office of University Advancement. And please don't forget to share a selfie of yourself watching tonight's event using the hashtag WesternUHeroes as you see here. On behalf of Western University of Health Sciences, thank you to our sponsors and donors and attending A Tribute to Caring, Frontliners, WesternUHeroes respond.